The thespian in me is very excited because this gentleman hails from the hometown and the setting of Romeo and Juliet, Verona, Italy. Listen to this lovely accent, ladies and gentlemen, Giovanni Cacciamani.
Thank you so much for the kind introduction. So, and thank you so much to Kim and to Aditya and to everyone for the kind invitation, for being here to discuss something that is very close to my heart. This actually became something that is very important to me when 2 years ago my fiancée, she was diagnosed with cancer, with leukemia. And as a doctor, I figured it out myself. It was extremely difficult to read the informations about a disease that was not specifically part of my field, that I'm a urologist. And I figured out if that is difficult for me, how could potentially be difficult and challenging for somebody who is dealing with cancer, or families that are trying to figure it out, new treatments, or just understanding anything about the cancer. So, and you know, as the director of the AI Center at the USC, we are trying now to figure it out some ways for making AI practical, from bringing back the joy to practicing medicine, and why not, to helping patients in understanding a little bit better about their diseases. So, do you know that you can treat asthma drinking your pee? Apparently, yes. And do you know that you can have coffee enemas that actually can very integrated for cancer treatment? Or why not? You can actually use baking soda for treating cancer. And just using crystals, you can heal in tumors. Those are few of the amazing news that you can find on the internet. And here's the point. 61% of Americans are using internet to gathering healthcare information. And you know, these data were from 2009, and now we know that these data are between 74 and 85%. This is the Dr. Google thing that we were talking before. Dr. Google is always around the corner. And sometimes we feel that we are the second opinion on the first one. Some patients are coming to us already after having consulted Dr. Google at the first sign or symptom, or after the medical consultation. And the issue and the problem is on us as physicians. Over the past 100 of years, all the medical information that we provide are not tailored for patients, are just tailored for our peers. And chances are that on the internet you can find, again, that you can drink pee and actually you can feel better. So now here's the point. When you're looking at the medical information for lay people on the internet, you can find, you can select the information, and those information are required to be readable for be understandable, right? And in terms of understandability, there are very few studies that are looking at how patient information can be understandable when they are readable. So again, you can find the random information on the web that are more or less readable, but not certified, like bloggers, not certified web pages, or baking soda. On the other side, you have medical literature abstracts and the patient education materials from the associations, which are extremely certified because are written by physicians for patients, but are not readable. And that is the problem. So, and we really want to bring this paradigm from not readability to readability and certify. So why is it important? Because a patient that understands medical information is an informed patient, is also somebody that is empowered with superpowers that, when you go to the physician, say, no, it's not true. Or, hey, I found this trial that could potentially fit my disease. Increase trust, enhance engagement, and most importantly, in 2024, we don't want to leave anybody behind. Equity, inclusiveness, and accessibility of the medical information is key. So, in 2014, and then was updated last year, the European Union put together the summaries of clinical trial results and laypersons. So, some guidelines that should be followed every time as physicians or academics we are writing a layperson summary on scientific contents. Is a very boring 25 pages document that is impossible to follow. They claim and they ask us to follow these rules for improving readability when this document is basically unreadable. So, and for this reason, and it's very difficult to follow. And our team and also a team from Ireland, we tried basically to test if the layperson summaries and the urological literature were actually readable or not. Spoiler alert, no, none of them. So European Association of Urology journals, which actually are the only ones up to 100 journals that are the ones that provide a layperson summary. Well, none of those layperson summary reach the threshold for readability and therefore are totally useless. Same for patient education materials. Looking at, for example, the patient education materials for cancer like prostate, kidney, testicular, etc., the red line is the minimum threshold for readability. None of the patient education material is reaching those minimum threshold, which means that there is a huge effort, but none of these data, none of these education material are basically veiculating and giving you the information in a way that can be understood. So our team is now working on making those information for readable to not readable. We created these, I don't want to go over too much in these details of this generative AI pipeline, where we created 3 different generative AIs and large language models that are interlinked with each other for extracting the information, digesting the information, and providing layperson summaries that can be used from patients and from caregivers and families. We tested our system recently with this publication. Again, I don't want to go over too much of the details, but as you can see here, our layperson summary generated by generative AI is more readable compared to the abstracts and compared, of course, to the layperson summary that provided by some journals. And just to mention, this study was on the cover of Urology Practice. It was also cited on Time magazine in a paper, in an article that was totally against AI in healthcare, but they were mentioning, wait, technically we can use AI for summarizing some information for patients. And very recently, our team has put together this other study, the Bridge AI 1, where we look at basically the readability for some patient information. I don't want, again, to go too much on these details. So here we are for proposing you the Bridge AI Study 1, bridging readable and informative dissemination with generative artificial intelligence. Our team is now partnering with the most important foundation, Prostate Cancer Foundation, Kidney Cancer Foundation, Bladder Cancer Foundation, of course, the Testicular Cancer Awareness Foundation, thanks to Kim, and the amazing people that are here today. And our objectives for this, for this study is to evaluate the understandability of the generative AI layperson summaries that we create with our technology, which is totally free, just want to mention, evaluated the preference for layperson abstract over the original abstract, and also looking at any improvement in understandability and also the time that you're spending for reading those information. So this is the aim of the method of the study. So 10 studies will be selected for each cancer. Each study, of course, has their own scientific summary that are extremely dense, extremely difficult to read, even for us. And our technology is summarizing, digesting all those information in layperson abstracts. This is just an idea of our system. As you can see, the name is Pub to Post. We created Pub to People. It is a system where you can literally copy and paste in the abstract of any scientific literature, and automatically the system from the abstract that you can find on PubMed is generating automatically in 10.3 seconds layperson summary that are understandable, readable, and we want to, of course, evaluate the understandability over more than 200 patients that has a testicular cancer. And most importantly, one of the parts is that we implemented also Whisper AI technology that is able to read for patients right away.
Background. This study looked at eye health and services in the Pacific Islands from the year 1980 onward. Methods.
And of course, we can translate it in up to 57 languages and with the readability score. So again, this is the methodology. The patient will be you guys will be randomized in 2 groups. One of the group will receive the original abstract. The other group will receive the new version of the abstract. And we will ask you basically the same set of questions to test basically the understandability. If you are taking a picture of the QR code, you can be basically enrolled in the study. And this is just an example of the survey. As you can see, Group A will receive the original abstract, very scientific, very dense. The second group will receive the AI layperson summary abstract, and the same set of questions. And then those set of questions will give us the chance to understand the understandability from your side about this kind of technology. And this is just an example of the survey they will receive. You will receive 10 scenarios, and it will take probably 40 minutes, but we provide a 25 Starbucks card. Please don't use it for coffee enemas. And no, because 25 is not enough. And or a $25 Amazon card. And again, here's our main goal. Journals are publishing papers, and papers as scientific summary, which actually are the only part of a scientific paper that is available to the general public. What we want to do is bring in to PubMed the layperson summary, the layperson abstract, as the new standard for any kind of scientific literature and scientific publication. From this, where you have only the scientific abstract, to this, where we have a new layperson. So we already started a conversation with PubMed. Results of this trial will help in making the point with PubMed that we want this layperson abstract part of the scientific literature, because we don't want anybody left behind. Just want to thank our team and Tasnim Usari and Ethan Lane, who are here in the audience. They will be more than happy to answer to all your questions. They are the real soul behind Bridge AI. And again, please, enroll in this trial. Thank you, Kim. Thank you, Aditya. Thank you, everyone, for inviting me over to discuss. Yes.